infantile colic remains a common concern among parents and healthcare providers. It is characterized by repeated episodes of intense crying in babies under 5 months old, often without any identifiable cause. Infantile colic is estimated to affect 3 to 28% of infants worldwide. While the exact origin of colic is still debatable, contributing factors may include digestive discomfort, immature nervous system, and sensitivity to environmental stimuli. The way forward involves increasing awareness, offering support to caregivers, and encouraging evidence-based practices that can help soothe and manage colicky infants. We'll be discussing infantile colic, causes, risk factors, and of course, the management strategies with our expert today on your favorite health TV talk show, The Physicians. Another beautiful day on your favorite health TV talk show, The Physicians, where your health is our business. My name is Dr. Memuna Yusuf Kadri, and of course with me today on The Physician is no other person than my lovely anchor and no other person than...
My name is Dr. Martina Agberi. Welcome to The Physicians, where your health is our business. I will always remain our business.
Today we're talking about infantile colic.
Memuna.
I know you have a story.
Oh, I have a story. I have a story to tell about infantile colic. And then I didn't realize it was actually infantile colic. You know, my first child, I had him when I was still in medical school, right? Got married in medical school. And this particular night.
And it's in the night.
Oh, God damn it. He started crying.
Where help is limited.
He started crying. And that time, of course, I lived with my very beautiful, lovely, kind-hearted pediatrician, Dr. Nike. She was doing her residency then.
So you had the support.
So I had the support with her in her house. Then I just had my baby, so we're in her house. And so then she's the godmother. And the boy started crying. There was nothing I did not do for that child. I breastfed the child.
Started crying with the child.
He was crying, he was wailing, he was weeping. At night, the pediatrician carried him. She checked everything that needed to be checked.
Everything was in order.
Everything was in order. No reason. What else?
Now started thinking maybe it's village people.
I didn't even. Mine was at that stage. At that point, you know, he's the first child. At that point, I felt, why is it not happening to me? Why him?
Yeah.
If only I'm able to know why this child is crying. I was feeling so frustrated. The doctor just said, Martina, you know what? Don't worry. I've checked everything. Everything about this child is fine. There's no reason. Nothing is wrong. Just let him cry. His ventilation will get better. The boy was crying. All the family, the siblings in the house, to tell you how bad it was, they carried their pillows on their head to cover their own ear. Because the night he was crying, and they need to sleep. But this boy refused to stop crying. So they just put their pillows on their head, and you know, so that was an experience
that you never
forget.
And
after a while, he just slept off. We didn't give anything.
The good thing about this is
give water, give this.
Everything.
Yes.
Everything at that point. But the fact that we have an expert in the house that's going to, you know, we have a lot of new mothers these days that don't even know what to do. Gen Z mothers, millennials, sometimes even the elderly ones that had their babies late and they don't know exactly what to do. And you start going here, asking questions. In fact, some people call for prayer meeting, put it on their WhatsApp group. My baby is crying, I don't know what to do. Everybody get up and start praying. We have an expert in the house that is going to deep dive into infantile colic, causes, risk factors, and of course the management. We'll be right back after this time at do stay tuned.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite Nutritional Supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Dermot, love yourself.
Welcome back. If you're just joining us, this is your favorite health TV talk show, The Physicians, where your health is our business. Today on the show, we are going to be discussing a very important topic that is highly not looked into, but very distressing, especially to newborn mothers and, of course, the fathers and the whole family in general. And that is infantile colic, the causes, risk factors, and the management. With us in the studio is no other person than the beautiful consultant pediatric gastroenterologist, and she is no other person than Dr. Ifeoma Ezeoma. If you don't remember anything, remember the Omas.
Yeah, thank you very much.
Once again having you.
Yes.
Welcome to the physicians again.
Thank you very much. Always delighted to be here.
Dr. Ezeoma, recently a man killed his child because he didn't know what this is all about, the infantile colic. Before we even go into what infantile colic, let's quickly bring that to the forefront now. Why would he have done that?
A father to kill the child.
Infantile colic is something that is worrisome, especially when you see your child crying excessively, and not that the cry is normal cry. Children cry all the time, but in a child that is having colic, their cry is so high pitched cry. It disturbs the whole house, and also no matter what you do, try to console the child is not consolable. So it's an inconsolable cry, and the cry comes frequently. You see a child crying for over more than 3 hours or over 3 hours, and the cry comes 3 times in a day, in a week, and also for 3 weeks. So the cry is something that
Or was that the reason
pattern?
why?
it's stressful, it's distressing, and maybe they didn't understand what was wrong with the child. So a lot of stress in this country. So that's the thing that will have also
Killing that child is
attributed,
actually
not
a no-no.
knowing what the problem is, and possibly the father has a mental health.
I was just going to say that.
He
I
has a
believe your
mental
child
health,
has a mental
because no matter what, if
condition.
his child is crying, the best thing you can do is to take to the hospital.
Exactly. If you
Just say, if you don't know
in
anything,
fact,
do.
what came
So
to
there is
mind
a
first
background
was the
mental
mental
illness
health.
in the father too.
The reason why we are here is for us to educate us, even though we are physicians, and our viewers. So, what is it about infantile colic that we need to quickly nip on board?
Yeah, it's something that every mother should know about. Even me, as just like what you narrated, even me as a pediatrician in training, then I was so troubled about my son's infantile colic. Well, the colic is so disturbing, and you can't bear the fact that you're seeing your child crying. You try to do everything, and the child is not stopping to cry. So it's something we really need to bring to the fore, so parents to understand and to reassure them that is this something that happens in children once they are 2 weeks of life, and is usually worsened from 6 weeks of life, and by 3-4 months everything it stops. So it's something we need to understand so that they'll be able to bear with it, and we're going to learn some soothing techniques that they have to imbibe when it comes.
So for children that have infantile colic, apart from that cry that resonates with most mothers, what do you think is responsible? What can be the causative factor?
Okay.
Because for the child to be crying, there's a reason.
There's a reason.
So what do you think is responsible, is accountable?
Well, we've just
That
been...
is sort of like the risk factors?
Yes, risk factors and the causes. We have some suggested risk factors, postulated risk factors, but most of the time we don't even know what are the causes. These are the possibility. For children, their digestive tract is not yet well formed, it's immature, so there's usually excessive sensation within the gut, and also some feeding technique. They gulp a lot of milk, so they take in a lot of gas, so there's a lot of gas in the tummy that makes them uncomfortable. Sometimes for breastfed babies, there's some things or kind of food that the mother takes that maybe the digestive system of the baby cannot be able to handle, or causes a kind of inflammation or kind of sensation within the child's intestine. Another thing, if the child is on cow milk, so there's some allergies within the cow milk, So these are the things, and also most importantly, psychosocial problems within the home, unstable home, when there's always noise, trouble, and all this in the family.
Really?
The
Yes,
baby feels
they
those
perceive
things.
a lot of things. Babies perceive a lot of things, so they perceive it, and these are the things that can cause it. But those ones are the down. It's not really the most important risk factors. The most important risk factors are these ones I've said. Then also reflux. Children are prone to having reflux at this age. Reflux, usually we have a junction between the esophagus and the stomach. So we have a sphincter. We'll call it a gate, kind of. So this sphincter tries to prevent food from coming up from the stomach to the esophagus. So if, and in children, their sphincters are not well formed, that junction is not well formed, so there's usually an effortless flow of food from from the intestine or from the stomach back to the so all these things makes the child uncomfortable. So these are the things that can contribute to the infantile colic the child will have.
So from what you just said, it just means that children that are preterm will have a lot of these challenges, right?
The preterm babies will not really like a term baby.
Because I'm talking with respect to the digestion.
So preterm baby will not, they usually don't have colic. It's usually from 2 weeks. Preterm babies, a lot of things are not well formed. So even the sensation within the nervous system, so it's not really well formed as like a term baby, baby. And the thing about this infantile colic is that it happens in healthy children.
Okay.
So there's nothing wrong with the child. The child is otherwise healthy and is okay. It's just that the child will be crying inconsolable.
Before you continue, you said at the beginning you said something about three weeks.
Okay.
No, that's at 2 weeks.
That's okay. That's the pattern.
Pattern, yes.
Yes. So it starts usually from 2 weeks of life. Peaks at 6 weeks. That's it worsens around that 6 weeks. That's where the cry will be so much. Then from 3 to 4 months, it stops. It starts reducing. So that is the way it is. Yeah.
So at home, when a mother begins to see the child having colic, okay, what are the immediate things? What are the things that the mother should do to that colicky pain?
First of all, the mother should calm down. Shouldn't panic.
It's very easy to say.
It's really very easy.
Imagine that you calm down.
Even me self as a I find it was so horrible. I was praying. Because I knew what it was. I was praying for let this 3 months come. Please, can this 3 months come? That this thing is so much, So that's how it is. So the mother should calm down. But that being said, you shouldn't mistake a child crying for just colic. So we really need to first of all calm down, then take to a physician, a pediatrician to assess your baby. Just like what you said, you're with a pediatrician. So you need to really assess the baby. We need to examine the baby. We need to be sure that it is infantile colic. Infantile colic is like a diagnosis of exclusion. Yes. You'll have ruled out other things that could make a child to be in distress before saying this is the colic. And you also have to check the anthropometry. It's very important. Is the child growing well? You have to plot it on the graph. Is it growing at the age? Is it the weight gain? Is it appropriate for the age? Are other parameters appropriate for the age? These are the things you have to look out for. Then also you have to properly examine the child. Look into the ear, the throat. You listen to the heart. Auscultate and know if there is any other thing. Touch the body, any pain anywhere, to be able to be sure that okay, I've checked the child is fine. The child doesn't have any fever, so you can now say this is an infantile colic for you to be sure, make sure of the diagnosis.
Now let's go back to Dr. Ifeoma Ezeoma. Let her tell us more about soothing techniques, apart from calming down to no touch, any swelling, any pain, any inflammation, any redness. What are other quick soothing techniques that mothers and of course fathers should know about, and grandmothers, because they come for the omugo before they go to the pediatrician?
Yeah. Okay, there are a lot of soothing techniques that the parents should be able to know. Especially we encourage them to ensure that the child is bobbed well after eating. So after eating, you can put your baby at your back or here, that just tap the child, tap try to help the child to expel some gas, and you make sure that the child burps well. Then you can also hold the child, like carry the child. I thought I would have come with a dummy. So you can place the child like this with your hand, support with your hand, and use one hand to support. And you can also suit the child like that, pat the body. You can also do like the baby on the tummy. Lying the baby on the tummy has also helps them a lot to suit them. Then also you can put them on the lap, and that lap and rock them on the lap and rock them, so they like rocking. There's another one called the bicycle technique. So bicycle technique, you just lie them and now rock the legs. It helps to stimulate
All
them.
this is when you are calm.
Yeah,
Because when you are not calm,
that's
you
why
can't-
you reassure them first and tell them this is what it is. After you've already made sure that there's no underlying illness in the child, then you use all these soothing techniques. And as I said earlier on, take history, check the mother if there's something the mother is taking that is not right, and also the child. So these are the things.
Okay, now we talked about this infantile colic, and of course, how it can actually make parents feel very anxious. Okay, so what do you think? How do you think can affect their mental and emotional health here? Because you are like helpless. So what advice will you tell the parents, apart from just sitting down and watching your child cry? That is really frustrating.
So calm and reassure them. Reassurance, keep reassuring. Sometimes you see them, they'll keep coming to the clinic. You just keep reassuring them that it's a matter of time. This thing will go. It's a natural thing. And it occurs commonly in children. Every 5 child you see, one will have infantile. So you can imagine how prevalent it is. So it's something that happens. So it's just to reassure them. There's nothing else you can do unless they have underlying mental illness that they need to be evaluated by a psychiatrist. Refer to Dr. Kadri for them to see.
But is there something about infantile colic gender sensitive? Maybe boys more than girls or girls more than boys?
There's no sex predilection.
There's nothing like that,
Yes,
right?
there's not.
Because I've had a case where the parents said, no, you must admit me. I was a house officer. They refused to go back home. They wanted admission, like they said there was no bed, and truly there was no bed. I did my house job in a government establishment, but beds are like hot cakes. It's very pediatric ward.
Yeah.
See, it's infantile colic. Professor came, consultant came, other people, the matrons. The woman said, and the man, the 2 parents came.
Because
and
they
I
know
think,
what
so
they've
what
been
now
going
happened?
through.
Yes, exactly. They say, that's why people will tell me to go back home
And
now.
the child was
And the
crying.
child- and we realized, at that point, because I already told myself I was going to be a psychiatrist, so I said, you are more anxious because it's your first child. Maybe if you had another child in the house that could tell the difference, that the woman said, this is the only thing that you said to me. I said, with all my professors and everybody saying that this is the only thing that can give me reassurance that I can go, because there's no other child in the house for me to compare with. Do you know they did not go? They went round town. It's Lagos now. 2-3
see the
hours
same
later,
thing.
they came and they said, the child is still having it. The child is still having it. Admit us. We admitted them.
Yes, I wanted to say that
admitted.
when parents are very, very
Anxious,
insistent on
yeah.
something,
Yeah.
just
We
admit.
admitted.
Because
They
if
never
anything
can say.
happens, it might not be that thing. They will
Yes.
come and
Yeah,
they will
we
hold you.
admitted.
So always listen to the parents. Even if you think that they are wrong, just listen to them. Admit the child, and they will see that it won't make any difference.
Right? Because I think that was the only thing that that helped us at that point. So what would you give to new parents who are feeling overwhelmed by colic and unsure if they are doing something wrong? Like especially new parents. We have a lot of new parents now that we are in that position where some of us are becoming grandmothers, and we don't have time. Everybody is doing whatever, and they're not doing the home work that we enjoy. So what is your advice to this new?
New parents, especially those that actually do exclusive breastfeeding.
Yes.
Because now there's nothing you will tell those people that will give them reassurance. To tell you the exclusive breastfeeding, and will be told that nothing will happen to the
my
child.
child.
The child's digestion is perfect. This is perfect. So how? Talking about milk, I'm not taking anything. So how?
Yeah.
So
You need to keep counseling, and counseling doesn't start from when they have the baby. That's why antenatal class is very important. It gives them enough time to prepare, and not only just talking. You can refer them to some links to go and read, to go and watch videos.
Doctor.
No, that are
You
scientific.
know why I'm laughing?
I know.
I'm laughing because antenatal, with that multitude, you want the midwife, the nurse, to start talking about infantile.
No, antenatal classes, they discuss things in the morning before they start the class.
You think they will remember to tell them about that in future? The child may come down with something called infantile colic.
You cancel them. Once they come to you, you still cancel
You,
them.
the physician,
You
may be able to
do
but
that.
it's not a routine.
Yeah.
It's not a routine that you will not say, okay, you want to cancel about infantile colic.
That's why this
Where
program we are
that thing
doing
coming from?
is important. That's why
Yeah.
it's important. It helps to sensitize them
Yes.
and make them to know what it is.
So to all the new mothers out there, infantile colic will happen with your child from 2 weeks, peak at 6 weeks.
May. Not
May,
that it
yes,
will
no,
happen
not
in
not of
May.
the child anyway.
Yeah.
May, because truly some of us did not experience.
Some
this
doesn't. So
infantile-
that's why we say
Yeah.
every 5 child
Child,
one. So
one.
it's not all the children that will have it. There's some that don't even.
When was that the first child?
So what are your last words to mothers or generally to parents out there, especially to the grandmothers who come for Omobo? Last words.
Okay, the last word from parents, especially for our grandmothers, are you know that medicine, things are changing, medicine are evolving, so you have to really work with what is happening with the trends now, and also listen to your physician once they advise you, because sometimes we advise them, the mothers will go back and say no, they're not listening to what the physician tells them because they use it for their children and this one is going to work. So they have to really work with their physician. It's very important, and listen to their physician. And you mothers, the mothers, you are more enlightened, you're more educated. It's not everything your mother tells you to do that you will do. You should know when to cut it or when to draw the line. Thank you.
You know why I'm laughing, because on the platform, okay, residence platform, there was a day that somebody just posted, please, does anyone have pawpaw leaf? I need pawpaw leaf and all this. So I had to send a private message. Why are you looking
asking for pawpaw
leaf? And by that she was done talking, I had to scold her that the challenges that will come out of the use of that thing is not what overwhelming.
That's it.
That she didn't need to use pawpaw leaf for anything.
Anything.
Just bring it, do this, that one. And you know, I had to save her name like pawpaw leaf.
So pawpaw leaf mom.
Yes. You know, she was very young.
Yeah.
She had no idea.
Yeah.
So one should also be sensitive. When you see such things on your platform,
Yeah.
ask questions.
questions.
So that the person
And
doesn't do the
educate
wrong
properly.
do the
Yeah.
wrong thing.
Yeah.
Thank you so much once
Thank
again,
you
Dr.
very
Ifeoma
much.
Ezeoma. And of course, to all our viewers out there, you've heard the whole story. Infantile colic happens in 1 in 5 children. It's not every child that we have it, but 1 in 5. It starts from 2 weeks of age, peaks at 6 weeks. By 3, 4, 5 months maximum, it has gone down. It takes a whole lot from you, the crying, the waiting for the child to be suited, and of course, and the child to sleep. But there are a lot of things you can do right there. Pop anytime the child finishes eating. Then watch what you eat as a mom, especially because what you eat is what this child is taking in breast milk. And if the child is taking anything cow milk, also watch and see where those changes come from, so that you can easily nip it on board. Rock the child, do the scissor support. But if all these things you've done, please don't forget to go to the pediatrician so you can get the best of help. Counseling is still a very important way to calm you, to make sure that this is just one of the normal things that are called in childhood. But again, just know that support family members. So if you are not the mom, husband, everybody that is available there, please support that mom so that she can pass through this phase and be seen. My name is Dr. Memuna Yusuf Kadri. Until next time, remain blessed.
So thank you, Dr. Zara, for coming again on our program. And actually, you did really justice to this topic. I appreciate you, and I'm sure viewers out there will also be very excited hearing from you. We rest assured I will still invite you again to come and take on some other very interesting topics.
Thank you very
and
much.
Viewers out there, the only thing that I will say is he talks about calming down. Just relax. You need to also calm down, because for parents, for mothers especially, when you are anxious, you will miss the very important things that are happening around that child. You need to just calm down, relax, watch out for things that are happening, ensure that the child, if you have done everything that we have talked about here, and the child is still not having a respite, ensure you go to the hospital. But most importantly, calm down and observe before you take that child to the hospital. Remember to follow us on our social media platforms. And if you want to be part of this program, like Dr. Ezeoma, just go to our website and fill the form. Then you'll be part of our program. My name is Dr. Martina Agbere. Till next time, stay blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.